The presentation I wanted to focus on for this video update was one from Dr. KERSTI SEKSEL, and that was called When Dog Training Can Help and When It Cannot. The dog's welfare depends on you. And of course in that context she was talking to the veterinarians, but it's also very important that trainers and veterinarians collectively understand that statement, the difference in that statement. Now, Dr. SEKSEL stated that training is useful for teaching basic manners and dealing with some behaviour issues, and we can look at those things as being training our dog to walk nicely on a loose leash, requests like sit, stay, coming when called, training them to use a mat, managing their behaviour like jumping up behaviour that might be occurring in everyday situations, also some types of behaviour like some chewing behaviours, some types of digging behaviours. Dr. SEKSEL also stated that training won't assist with medically based behaviour issues because they're diseases, and this is specifically the role of the veterinarian. And when we think about it, of course, diagnosing and treating medical conditions in animals is the role of the veterinarian, not the trainer. Now, Dr. SEKSEL also touched on a really important point. The dog training industry isn't regulated. Anybody can call themselves a dog trainer, a canine behaviour specialist, and not be qualified, and therefore not able to understand when a dog is going to respond to a situation that is going to be addressed through training, as opposed to when a dog actually does need to be seen by their veterinarian for a medical examination and a general behaviour screen to rule out any contributing medical causes there. Now, also Dr. SEKSEL stated that a good trainer will refer to a veterinarian. So it's important that when we're looking at choosing a trainer, that they're appropriately qualified and experienced, and certainly positive reinforcement trainers should be adequately qualified and experienced in identifying when a training situation isn't going to be adequate for addressing your dog's behaviour and when your dog needs to be referred over to a veterinarian. So the other interesting point that Dr. SEKSEL raised was that some types of anxiety can also manifest in us seeing gastrointestinal problems and skin diseases in dogs. So once again, it harkens back to that very important point that trainers and veterinarians are working closely together so they can then provide the best patient and client care and outcome for every dog for their individual situation. And it's also interesting because when we start changing the language that we're using, we're also asking more important questions rather than sort of saying, oh, how can I get my dog to stop barking, stop scratching, stop chewing things, stop jumping up on me. If we stop asking how and start asking why is my dog performing that behaviour, then we understand that there is a valid reason for that dog's behaviour, and training may actually address that behaviour or it may not. So once again, it's very important that if you find that your dog isn't responding to training in a situation where you're hoping to change their behaviour, if they're not responding, then that's a red flag that you need to seek out help from your veterinarian just to make sure that there's no underlying medical contributions to that behaviour. And again, the importance of dog trainers and vets working together puts everybody on the same page with respect to the patient care, the care of every dog in that situation, and making the focus on the physical and mental health and welfare of our dogs.